Today we will be talking about a change in practice in the self-management of asthma. The proposed practice change is the education of healthcare professionals in understanding inhaled medications, particularly correct techniques in inhaler use. This is to ensure that patients are receiving the best advice, information, and assistance. The key elements of the change in practice essential to the improvement of self-management of asthma are: identify the correct use of inhalers, education and instruction of the correct use transferred between healthcare professionals and the patient, and lastly, the addition of education and ongoing assessment during clinical reviews. Each of these elements, when combined, provide comprehensive and consistent care for all patients over time. The identification of the correct use of inhalers is necessary to ensure that the correct instructions are being provided to all patients. In providing education and instruction of the correct use of inhalers, healthcare workers are able to eliminate any hesitancy or concerns a patient may have in regards to their medication. This also identifies any barriers that may not have been considered during previous consultations. This is also an integral part of all interaction when discussing the self-management of asthma. The addition of education and ongoing assessment during clinical reviews ensures that patients are consistently checked to be administering their medication correctly, but it also provides extra support for their self-management of asthma. Before moving on to why this change is needed, I would like to show two very similar looking inhalers. These inhalers may look similar, but they need to be administered differently. This is very important to know as most patients will not know this. The MDI can be used with a spacer and needs to be shaken well before use. You are also able to do single breaths or tidal breaths. Tidal breaths is just 4 breaths instead of 1. The Spiromax, however, should not be shaken before use, and a spacer is not necessary. For this inhaler, you only do single breaths when administering it. The importance of these examples is to highlight the differences in administration of inhalers. Although there is only a slight difference in these inhalers, the correct techniques are not common knowledge among the general public. So, why should we change? This practice change is needed for the improvement of patient outcomes and develop healthcare workers' knowledge to provide appropriate care. Studies have shown that the lack of knowledge that healthcare workers have on how to correctly use inhalers influences the patient's outcomes negatively. Studies have shown that 63% of patients were incorrectly using their inhaler, but after continuous intervention, this has significantly improved, supporting the need for this change so all healthcare professionals are able to provide the correct information. It has also been shown that 5% of medical interns could not correctly use an MDI, and only 15 to 69% of all healthcare professionals were able to demonstrate the correct technique for inhaler use. This needs to change. It has also been shown with regular interventions, patients feel more supportive and their self-management of asthma improves. It also provides them with the sense of more control over their asthma management, and all questions or uncertainty they have is addressed more rapidly. Patients have also expressed a lack of consistency and continuity when interacting with healthcare workers. This change will provide healthcare workers with the same expectations and information to ensure that all patients feel that the production of advice is more consistent and tailored to their needs. Thank you for your time today, and I hope we all understand why we now need to change our practice in the self management of asthma.